not possible for me because my husband is doing one thing or the other, and I'll not kill my own child. I'm the one that carried that passed through the process. Even if it's CS, you always
feel the pain.
So why would I decide to kill my own child?
Different reproductive process has their own pain, especially for women. So I felt we should enlighten people about it.
The hormonal changes, the vomiting.
It is actually not. It's actually not so easy. Now, hello everyone and welcome to Reprocare. I'm your favorite host, Shilola Damilola Okpeyemi, and just like you know, Reprocare is all about reproductive health care, where we're bringing up topics and guests to discuss different reproductive health issues. And today, I'm excited to have with me on the show a very important guest, all the way from Neuropsychiatric Hospital, Haro, Abeokuta. She's a registered nurse, a registered mental health and psychiatric nurse, a mental health advocate with passion for quality healthcare delivery. You're welcome to the show.
Thank you, Mr. Show.
So can you please introduce yourself to the...
Well, my name is Nurse Oshewa Ruth Oluwasefumi. I'm a mental health nurse and psychiatry nurse. So I'm so happy to be here today. Thank you for having me, Mr. Show.
You're welcome, Nurse Oshewa.
Yeah.
It's really good to have you. It's really a privilege, and I'm happy you honor our invitation.
Thank you so much.
So, Reprofam, today we'll be discussing on a very interesting topic, which is the first stage of reproduction. You know, the most beautiful thing about being a woman is being a source of a new life.
Yes, sir.
And then this reproductive process requires a lot of energy,
yes,
a lot of reactions.
Hormonal changes.
Exactly, a lot of hormonal changes that can actually affect, number one, it can influence our mental health and then self-esteem.
Yes.
And also it can affect our relationship and quality of life.
Yes.
Like I used to tell people, during the time where the sperm, travels down to fertilize the egg,
okay,
a lot of things can happen.
Yes.
And then beyond this process, a lot of things can happen that can affect our physical and mental health.
Okay.
Chemical pregnancy, for an example, this is just an illustration. Imagine a woman doing pregnancy test at home that came out positive. Now, just to be sure of what she has done or what she's seen, she went to the laboratory to rerun the pregnancy test, okay, and it also came out positive. Okay. Now, with joy, she went home and came back, a few weeks later for an ultrasound examination to see the development of the embryo, if the embryo is doing well, and to get the gestational age. And then to be surprised, she was surprised when they told her that there is no evidence of gestation, no evidence of embryo development, no gestational sac, no pregnancy, no evidence of pregnancy. And then she was asked to repeat the pregnancy test, which came out negative.
Wow.
You see, this kind of scenario, it's called chemical pregnancy.
Okay.
And chemical pregnancy is just a normal pregnancy that stopped development naturally. It stopped development naturally before or after implantation. A normal pregnancy, yes, the reason is not really clear, but it's naturally stopped developing before it can be seen on an ultrasound.
Okay.
And then chemical pregnancy is so early that most women do not notice they were pregnant and already miscarried it. But for couples, this is my point, for couples that notice they were pregnant, especially those couples that have been
expecting couples,
exactly, trying hard to get pregnant for a long time.
Okay.
Now they notice, she was pregnant last week, and then a few weeks later, there is no pregnancy. It can actually be emotionally, mentally, psychologically troubling, yes, disturbing.
Of course.
You understand? Now, Nurse Oshewa, the question is, how can chemical pregnancy, it is the first stage of reproduction we are treating today, which is pregnancy. Some process that can happen, during pregnancy that can affect our mental and, psychological health and well-being.
Yes.
So now, how can chemical pregnancy affect our mental and psychological health?
Well, Mr. Show, to expatiate on that scenario, there was a particular couples, like expecting couples that have been looking for a child for let's say 5 to 6, 10 years. Then all of a sudden, the wife got positive. It was positive to the pregnancy test or stuff like that.
She did it at home. It was positive.
It was positive. Then she went to the lab did the same test, run the same test, it was still
positive. Yeah.
Then she now later came back for the normal routine
ultrasound
check, and there was no pregnancy in the first place at all.
There is no
maybe there
evidence
was
of
pregnancy, but it's no longer there.
There is no evidence of pregnancy.
No evidence at all.
Yeah.
A scenario like this will always have a psychological effect and emotional effect on this particular couples in different aspects. So when we are talking about it holistically, talking about the psychological aspects, there's always a feeling of disappointment and grief. No matter, somebody that has been expecting something for a very long time, and then you get it, and you experience a brief period of joy. All of a sudden, it's just vanished into the thin air in your presence. So there will be a lot of feelings of disappointment, and they feel like, is it possible? There will be a grief process. Some people enter into the phase of depression. There will be anxiety and worry that, okay, is it that something is wrong with my body? Will I be able to continue? Is it that I can't carry pregnancy, or there's something wrong with me physically? And even to the people, let's say the couples, there will be a strain in different aspects that will affect the relationship between the husband and the wife. And imagine somebody that was already informed the mother, the sister,
of course,
the relative, the cousin that, okay, imagine, I'm now pregnant and I'm positive and this and that. Then how do you expect? There's shame. They will feel some shame and guilt that, okay, people will be laughing at me and they will feel like I'm a barren, that maybe some people even say she's lying. So all those things will bring about some grief process. It can even lead to this depression and anxiety. Wow. People develop post-traumatic stress disorder as a result of this fear of being pregnant again. They don't want to get pregnant. Some of them will not even want to move with their husband, so that there will not be anything that will lead to pregnancy
again, due to the fear and anxiety.
The fear that, okay, what if I'm positive again, and all of a sudden it's vanishing to the teen here.
To work on your points, I actually like the point, because you made it clear that some might be so scared of, getting pregnant again.
Yes, some might be scared.
Reprocare, the true fact is that chemical pregnancy does not really mean you cannot get pregnant again.
Yes.
Chemical pregnancy does not mean another pregnancy will not develop well. Chemical pregnancy does not mean you cannot carry another pregnancy to term. What it actually means is that something is wrong with the actual embryo, that is the baby, and then the reason is not really unclear, though it is always important we look into it. And number one is we call it chromosomal abnormalities or genetic abnormalities. When there is chromosomal abnormalities, there is always issues with miscarriage, because a normal embryo needs a normal number of chromosomes to develop.
Okay.
So just to give a point to explain to the house, a normal embryo needs a normal number of chromosomes. What we mean is that you need, for a normal baby to develop, it needs normal number of chromosomes, that is information from the mother and the father. You understand? Even from information that has been passed down from the forefathers will be, you can
the genetic.
Exactly. Yes. Like for me now, I look like my grandma so much. Okay. So that is an information passing down, we have that information. So when there is, short information or more information, that is when there is more number of chromosome or less number of chromosome, or when there is a defect, the baby or the embryo will not develop further.
Okay. Another
factor is age. It contributes
very crucial when it comes to pregnancy and the implantation of the fetus into the uterus.
Absolutely.
It's gonna be
there is another point most women do not take note of. Okay. That is reproductive tract infection. Most especially the reproductive tract microbiome. If you have, the lining of the womb, it is believed to be sterile.
Okay, yes.
And but nowadays, a lot of research has made us understand that there are some normal bacteria lining in the lining of the womb, in the vagina, in the cervix, even in the ovaries. Most of them has not been identified yet. So if you have dysbiosis, that is imbalance of this bacteria, it can lead to endometritis, endometriosis, infection of the lining of the womb, and pregnancy will not stay. Another one is the shape of the uterus. If you have regular shape, we have this biconate shape of the uterus. Pregnancy will not stay, and a lot of factors. So chemical pregnancy does not mean you cannot carry a pregnancy to term. Just to bring up the point of them
being scared of having another baby.
Absolutely.
Some of them will even judge, okay, do you think something is wrong with my system? Maybe I'm not even made to have. They question their motherhood, that, okay, is it possible for me to carry a pregnancy to term? So they question stuff like that.
Now, ladies, women in this kind of position or situation, I mean, become scared due to shame, anxiety. I feel this is attributed to their self-esteem. In the sense that they are not confident again to get pregnant, to pass through this reproductive process. And then for you to have a child, pregnancy is the first stage of reproduction, and they become scared. So what is the impact? Can you briefly or extensively enlighten us on the impact of chemical pregnancy on self-esteem?
Well, in a case like this, there will always be an impact on the self-esteem of the lady, especially both sexes, both the husband and the wife. But this thing has a toll on the wife more than the husband. Being the woman, she's the one carrying the baby, she's the one having the uterus. In a scenario like this, it will have an effect on their self-esteem, both the husband and the wife. Women always face one issue than the men, because they are the one carrying the pregnancy. Some men does not have knowledge about stuff like this. They believe, okay, maybe something is wrong with the lady. And in a society like this, we are quick to judge ourselves. Pessimism is so much among us, and negative self-talk and blame. People are quick to judge themselves. Okay, is it that something is wrong with me? And the feeling of shame. Okay, imagine somebody that has already, like I said before, informed the mother-in-law, even the sisters, brothers, and all the whole family, like that.
Exactly.
How do you want them to go back and say after 9 months? Because in a society like this, people start counting for you. Okay, she's 1 month, she's 2 months, and 3 months you are not bringing forth any sign of pregnancy.
Sign of pregnancy.
So things like that, they feel shame. There's a feeling of guilt that, okay, maybe something, and some of them does not even want to have issues with. They withdraw from people. The relationship with their family can change because of the fact that they don't want, and some of them do not want to even have anything. They feel like, okay, maybe I'm the one at fault. They question their body system. Maybe I'm the one that, people pass through different grief process. The way we pass through it is different from each other.
The way they process miscarriage.
The way they process it. Some of them, from there, they can develop depression, and they feel like they are not actually yielding fruits. Like, they are the one at fault.
Talking about depression,
yes,
before we go into depression,
yes,
I want to get this clear.
Okay.
We talk about women carrying the whole burden.
Yes, majorly.
Men
do, but the major burden is on the lady.
So the fact is that I respect women a lot.
This is a society where people believe like, okay, you gave birth to a lady, a girl. They believe it's the woman's fault. So imagine you having a pregnancy, and people that experience it like 3 to 4 times. How do you expect their family to talk? How do you expect the husband to feel? Like somebody that even gave birth to a lady, and you feel like, okay, it's your fault. Not even thinking about the fact that you are the one passing the X and Y chromosome. You understand? So somebody is not having a miscarriage 2, 3, 4 times. The blame will be on the woman. People do not have knowledge about something like
respect
this.
to all women out there, because they actually carried the whole burden of reproductive health issues.
Yes.
When it comes to infertility, women are the focus of blame.
Yes.
When it comes to reproductive tract infection, imagine the first thing you think is, I contacted this from my wife.
Yes.
When it comes to psychological condition, they face the burden. When it comes to CS and other reproductive process, women face the process. So I'm saying a big shout out, a big respect to all women out there, because easy.
It's not easy.
You're carrying a pregnancy for 9 months.
Carry a lot of things, a lot of blame, a lot of guilt.
Absolutely. Now let's look at the aspect of depression and anxiety, as a result of chemical pregnancy. Okay. What can you say about this?
Well, this can bring about depressions. You see them feeling withdrawn. You understand? They get withdrawn. And then during the grief process, there is a stage. Everything is in a stage. There is a stage for depression. But people tend to stay in the period of depression more than they don't want to move forward. They don't want to rebuild and go forward. And it depends on the kind of people that they are surrounded with. How some people stigmatize them. If it depends on people you are surrounded with. If you have people that already understand, maybe they understand what you are actually doing, you can actually move through the process of grief fast. But imagine being in a situation that did not have knowledge about this chemical pregnancy, and they feel you are at fault. People talk down on them, they stigmatize them, so they become withdrawn, they feel sad. Some of them become irritable. There's nothing, everybody that lose something, there's always a feelings of bereavement, feelings of loss. So they can be irritable. You understand? They can develop anxiety disorder because of this process. They withdraw from things what they loved before. They don't want to do it again. They don't want to do it again. They don't want to talk. They don't want to play with people. They don't want to see their family member because, how am I going to explain to them that I lost the baby?
Oh, you were pregnant last week.
I was pregnant last week. And I say,
somehow,
Mommy,
there's no pregnancy there.
How do you want to? They're like, are you like within 2 months? You just need the pregnancy like that.
I understand.
So they feel sad. And looking at the fact that some of them have been expecting for 10 years. And they just lost the baby like that. The process of the grief will be so long, and you don't expect them to be happy. You can't expect them to take the news like that.
Does it have an end point? Like when a woman enters depression, for a very long time, does it has this end point that there is no turning back?
There is turning back. It depends on how they go about it. Like the people you surrounded yourself with, people you talk to, the relationship with the husband, and seeking of professional help. You talk to your therapist, you can go for counseling and all sorts. Then you see a mental health professional to do all these things. Then they come out of the face.
So Reprofam, chemical pregnancy is not really a fake pregnancy, and then chemical pregnancy can trigger a lot of mental and psychological troubles. But please don't stigmatize anyone in this situation. It's not anybody's fault.
Yes.
No, please don't stigmatize. These emotional, mental, and psychological states it's actually very, very important. So stigmatization, we had more. We had more fuel to the fire, like they say.
Yes.
So please, Reprofam, don't stigmatize. Now, stigmatization can come from different angles.
Okay.
Number one is the society.
Yes.
The community we are. Don't you see Ikena? Or you don't see Mommy Esther we talk saying you get belle. Now 5 months we never see pregnancy. Imagine that kind of thing.
Yes.
Stigmatization comes from the society, the community,
even from the family member.
Exactly, that's where we go. From the family member also. Your brothers can be like, is it only you get pregnant?
Especially if they have their own child. Don't kill my child. Go and give birth to your own.
Now let's talk about between the couples.
Okay.
Stigmatization is possible.
Yes.
You were pregnant. You told me you were pregnant. How come? This is scan. We are doing scan. There's no gestational sac. They said there's no fetal pole. There's no sign of pregnancy. Some men can be so harsh. And women are so emotional, and the emotional states can easily develop into their mental states. So how can couples in this situation cope?
Well, in a situation like this, there will always be, people pass through the stages of grief differently. You understand? And imagine somebody that just lost a child. It is possible for the husband to take it in another way around, but the woman that actually feel the grief like as much as the woman, and something like this can bring about strain in their relationship. Some ladies will be scared of touching their husband. And they don't want them. It can bring about low libido, fear of unknown, that what will happen. And some of them can be irritable during that process of pregnancy. After the loss, they can become irritable and angry, and there will be strain in their relationship. Somebody that will be laughing before coming, all this stuff, and you now get home, she's crying or she's sad, and you want to say something. I beg, that's not what I'm doing right now. Don't stress me. All those things. They can withdraw from each other. So it is important. The first thing is open communication. Effective communication is
open communication is very important.
Yes, when it comes to you guys should talk about it, validate your feelings, express yourself, so that there will be emotional support. You should support each other, and you should always know that this thing is not anybody's fault. It is not the woman's fault. It's not the man's fault. It is something that can happen to anybody. So, and if it's something like that, okay, they can go for therapy sessions, like they can go for counseling, they can see a therapist, like that, and they can join a support group online, like that. And there should be an understanding between them. The guy, if it is the guy that is on the depressive side, the woman should know how to manage it.
So a man can also be in the depressing side, not the woman alone.
Mental disorder is not a respecter of any gender or any profession.
Reprocare, this is serious.
So anybody can. As a lady, you can actually get over it. But somebody, maybe your husband has been anxious that, okay, really, my wife is now pregnant. Maybe has even been painting, has bought some things. He can even feel, he can be depressed more than the wife.
We men, we also share the burden.
Yes, man, we can share. It's just that the lady or the woman is always on the high side.
Now, respect to all ladies. That is actually very insightful. They need to talk
about their emotions. They need to be somebody that can freely express themselves, so that they can pass through the stages of grief together. And there is need for understanding, like serious understanding, so that they can actually work things out. And their families need to support them too. You understand? They can't do it alone. And the wife, if it's the wife, the husband should try not to stigmatize the wife. That's why there should be enlightenment about it, so that people will know. They won't blame their wife about the situation. You understand?
So, Reprocare, in a simple way, open communication is very, very important.
Yes.
You guys need to discuss with open mind
and
respect.
To do it alone.
Don't do it alone.
Some people want to handle their problem alone.
I'm even surprised that men will also share burden of chemical pregnancy.
Yes, so
I actually did not put that in my brain, because I was like, it's women. Everything is women. Reproductive thing is women. So that is actually quite insightful. Yes. It's quite insightful. Now, let's talk about how women facing these issues. Now that it's not just women alone, how couples facing these issues can prioritize their reproductive health and then mental health. It's really important we discuss, how they can prioritize their reproductive and mental health. So for couples, it is not only women again, for couples having these issues, how can they prioritize their mental and physical health?
Actually, there are so many ways to go about it. Number one is seek medical help. You seek medical assistance, talk to a consultant. Don't try to hide it. A heart of an hero is you asking for help. You don't feel like you can do it.
Learn how to seek for help.
Learn how to, you understand? You should play it smartly. You understand? Don't feel like you are bold. Just be smart. And then you talk to people that can help you. And if you know that this thing is going on the outside, maybe you are developing a panic attack or anxiety disorder concerning this situation, talk to a counselor, talk to a therapist. Then you guys should relax. You understand? Take time to rebuild yourself. Give a breathing space. Then you should take notes. Make a journal about, okay, is it every month? How is this thing going about? So that you can have insight to the situation that is going on. Then you should enjoy healthy diet. You understand? Then there is need for support.
Emotional support.
The two of you should support each other. Okay. Don't allow that situation to bring about, difficulties. That's when you now start seeing fault in each other, and that's when you guys need to come together and plan about the future. Then you should always take care of yourself. You can go for exercise. You can do
vacations to clear up the memory.
Vacations. Absolutely. Enjoy yourself.
Absolutely.
Don't embed yourself in feelings.
Don't be down.
Don't self-talk. Don't talk about yourself badly. Don't feel like you cannot do it. The husband should always provide the support, and
the wife also should provide.
And the family members support.
Even I think the community also should support. Because it's a very important thing. Its mental state is so troubling. Yes. It is actually very, very insightful. The discussion is very deep and profound. So Reprocare, chemical pregnancy is not a fake pregnancy. What it means is that it is a normal pregnancy that stopped developing due to the fact that the embryo, is actually having a defect.
Yes.
And then let me just address some frequently asked questions to make people understand chemical pregnancy, because it can actually affect mental health, just like we've discussed.
Okay.
The first question is that, who do chemical pregnancy affect? And the real fact is, anybody. As long as you can get pregnant, you can experience chemical pregnancy.
Yes.
And now the second question is that, can chemical pregnancy be treated? Most people feel, okay, we should be able to do something about these issues.
Yeah, but in the times that, okay, that's why they should seek medical help. What if it's infection that is causing
absolutely
it? They can treat it.
So in a normal sense, chemical pregnancy can be treated by evaluating the cause, just like you said. If it's probably infection, we can do genetic assessment to know if there is a defect. We can also assess the shape of the womb. We look at the age factors and some other factor. Now the last question is, it is actually funny, but it is important to address it. Can chemical pregnancy be prevented? It is not preventable, because every woman who is capable, who is fertile, capable of getting pregnant, experience chemical pregnancy, but it occurs so early that most women do not notice.
Okay.
It occurs between the period of first week to the 5th week before an ultrasound can see it. And for people that notice, it's because of the production of the HCG hormone produced by the placental cells, gonadotropin. That is what gives the positive results you see when you go for your blood PT. You understand? And it takes weeks before this hormone wears off in the blood. So it is possible you notice, but chemical pregnancy cannot be prevented. Now let's look at, we are talking on the stage of reproduction.
Okay.
And we've discussed about pregnancy, fertilization, when sperm traveling to fertilize, the early stage. Now let's look at pregnancy itself. I've seen a lot of women come to the laboratory. Something happened. Though I have a lot of scenario. Let me start with this.
Okay.
I was about to take a sample, and this woman, I had to drag my hair. I was so scared and shocked, but looking at her, I felt this woman is heavily pregnant. There are a lot of emotional, mental, hormonal changes going on.
Yes, different. The hormone affects the way the neurotransmitter works.
Exactly. So I had to just tell her,
it's possible.
Madam, calm down. Like, though I was
angry.
I was actually angry. Like, imagine, looking at, because as someone that have passion for reproductive health, I felt for her that day. And this is one of the things that triggered my passion, my career, my vision, to assist every woman out there, every couples out there, on their reproductive health. Okay. Now, let's talk about pregnancy itself.
Okay.
And this is just an instance that happened last year. This woman came to the laboratory for an ultrasound examination. I've never seen her before. No, okay, she came. That was the first time I saw her, and she was angry. You guys did something, can you come, this and that. I came here before, I saw one short sister. She's very short and fair. Someone attended to me. She was fair, she was short, she was this, she was that. Then, looking at the whole thing, the whole scenario, we do not have any short staff. She said she did pregnancy scan, and then they gave her a certain age. And by now, I should have given birth. What is going on? What is delaying my pregnancy? Upon doing the scan, she's around 27 weeks. So,
okay.
Like, she was already saying that this thing is already going to 40 weeks. She was, going through a lot of things. And then I remember talking to you that night, and you made mention of hallucination during pregnancy. So my question is hallucination during pregnancy real? Is it really a thing?
Where hallucination is a thing during pregnancy, but it's just a rare condition. It can occur as a sort of hormonal changes. During pregnancy, there are different kind of changes that it is a process. So each process brings about different form of things, and it can be as a sort of sleep deprivation, as a sort of stress and anxiety, and it can occur as a sort of maybe the woman is having a mental health condition, like a pre-existing mental health condition before, and it comes in different form. There is what we call visual hallucination where they see things while you guys are not seeing. They
Wow.
see things you guys are not seeing.
That is interesting.
Yes, there's auditory. They
Wow,
hear
they
what
hear
you guys
things.
are not hear. You cannot hear what they're saying, but they'll tell you, okay, somebody is calling my name, somebody is talking to me, and
Wow.
he's saying I should do this, I say I should do that. And there's what we call gustatory. They taste what you guys do. My mouth is sweet. I'm licking. I feel like I'm eating rice. All those things is an hallucination. They are not actually tasting anything, but they can feel it. Okay, like as if something is in my mouth.
There.
Some of them feel tactile. They feel like something is crawling on my body at a particular. It can happen during pregnancy. So it's just that it is rare, but it's possible.
Wow, that is very, very insightful, because I was so surprised. Madam, we've not seen you before. Madam, who did the scan for you? Madam, it was so funny, but then I just wanted to run it by you then, and telling me hallucination during pregnancy is a thing. Wow, it's actually interesting. Now, that is pregnancy itself. Though there are a lot of factors, mental health issues that can arise during pregnancy. But then let's talk about after pregnancy, postpartum.
Okay.
There is this trending video online recently about a woman that gave birth and then killed the newborn baby.
I've not seen that.
It was trending. Like, I think it was around Yaba side, or I think it was trending recently, of course.
Okay.
And I can't imagine someone getting pregnant. She actually carried the pregnancy to term.
Okay.
She passed through the 3 stages of labor. You know, the stages of labor comes with serious pain.
Yes,
she passed through those pain, gave birth, and then killed the baby.
Okay.
Now, going to the comment section, I saw a lot of comments, a lot of views, a lot of reaction, and I feel people really need to understand some things. Though I saw a point pointing at postpartum depression, postpartum psychosis. So what is postpartum depression?
Well, postpartum depression is a form of depression that occurs after delivery, at least for a year. A lady might experience postpartum depression maybe after giving birth due to some reasons. There are risk factors, maybe as a result of pre-existing mental health, as a result of their neurotransmitter working in another way. It is common after delivery for a period of 1 year. They can experience it actually. So it is possible a lady experience postpartum depression. It's just a depression, a form of depression, and it is a serious condition that require immediate mental
attention.
Yes, it requires an attention. It's not something that you can just
people were saying abisinwi in Yoruba, like you born enter.
Abisinwi, that's Yoruba.
Some people were saying it was act of, the source actually claimed that it was act of revenge, because her husband has not been taking care of her.
Give birth to a child, and as a result of revenge, I will now kill my own. That's
it is.
We need to change our perception about some things, the way we see things and think about some things. We need to actually change it. It's not possible for me because my husband is doing one thing or the other, and I'll now kill my own child. I'm the one that passed through the process, even if it's CS. You feel the pain. So why would I decide to kill my own child?
Different reproductive process has their own pain, especially for women. So I felt we should enlighten people about it.
The hormonal changes, the vomiting.
It is actually not. It's actually not so easy. Now, there is something called postpartum psychosis also.
Yes.
Is there any difference between these two, postpartum depression and postpartum psychosis?
Well, when you're talking about psychosis, under psychosis, we have depression, we have mania, which is the bipolar form, we have schizophrenia, but everything is still under psychosis. So depression is still a form of psychosis.
So for a woman with postpartum, you said they are under psychosis, both the depression and everything. Now, what are the signs and symptoms of postpartum psychosis?
Well, there are some symptoms that the lady will exhibit, whereas we will just think, okay, this person is doing something abnormal. There will be a lot of changes. Number one is disconnection. You understand?
Disconnection from the world.
They feel disconnected from the child. They feel like, is this my child? Is this? They can even feel disconnected from the husband. There is period of sad. They can feel overwhelmed. They feel sad. They just started crying all of a sudden. They have mood swings. They become irritable out of nowhere. And if it's somebody that have interest in some activities, you just see them feeling withdraw. And they don't want to participate in what they have been doing. They lost interest in what they have been, something that they find joy in before. They see it as something negative. They don't want to participate. There will be changes in their sleep patterns and their eating patterns. Some of them lose the appetite. Some of them will eat voraciously. They even feel exhausted even after sleeping. So some will sleep too much. Some will have insomnia. You understand? There will be negative thoughts. The thought about killing themselves or killing their baby.
That's very bad.
Yes, you understand? Things like that. They have negative thoughts about themselves. They feel like the world is against them. Nobody loves them. And they feel there's this kind of persecutory delusions they feel toward their loved ones. Like, maybe my mommy is against my life. They are the one that want to kill me. My husband is a bad person. He's the one that does not want me to have a baby. So let me just kill this baby. Maybe this child is not mine. Some of them will even tell you as a result of hallucination that this is not my own. Delusions. They feel like this is not my own. This is not my baby. Who is the owner of this one? I'm not pregnant. All those things. So, and if they are not being supported or nobody is assisting them at that particular time, let's use the scenario that you talk about a woman, who killed her baby. Imagine her being deluded at that particular time that, this person is not my own, or having a persecutory delusion about the baby and nobody is around to assist her. So she find the baby like, she will see the baby as something harmful to her and then decide to kill. It's not, they feel disconnected from reality. They actually do not know what they are doing again. The reality is not there. Some of them are in the fantasy world. So that particular time, what she's doing is not clear to her. She might think that, this person, somebody that is hallucinating might see a hair, like the one I'm putting on my hair, and be like, this is a snake, and decide to want to help me to kill the snake, and then eat my head with something else. So imagine see the baby on the ground and say, this is earthworm, or this is cockroach on my bed, and let me just kill the cockroach. So stuff like that can happen. That is
quite interesting, and it is quite insightful, because I was just wondering, seeing the video, I had to go to the comment section.
There. We don't really know what is going on. She might be hallucinating at that particular time, and seeing the baby on the floor, she might even think, what is this bundle on my bed? Is it a snake? Let me just kill. And
Now let's look at, you've mentioned some, but let's look at the risk factor and how can women experiencing this seek for help.
Well, there are so many risk factors, like somebody that has a genetic history, that have somebody in your family already experienced postpartum psychosis before. So maybe your mother, your grandmother, maybe any history in your family. So you should be able to take care of yourself at that particular time. You should just be alert. It's like having a predisposition to a particular disease or illness. So maybe there is a family history of that particular disease. You should be able to take care of yourself to prevent something like that. And if somebody has a pre-existing mental illness, you have a pre-existing mental illness, it is possible. And when somebody is overstressed, overstress can cause it. Maybe somebody that is still maybe there is one particular disappointment. He has a particular something that happened to her during the pregnancy. Maybe she lost her job, she lost her mother, she lost her father, and she did not pass through the stages of grief very well. Then she still have those things up there, those things that she harbored inside her mind, in her head. So immediately she gave birth, all those things can come to play.
Can just trigger.
Can trigger. It can exacerbate the mental illness, the psychosis. So stuff like that. And somebody that is passing through a lot of stress, sleep deprivation, and so on.
So how can women experiencing this, how can they seek for help?
Yes. Number one, they should seek professional assistance. That is the first thing. You should always, if you know that you're somebody that has a mental illness before, don't overlook it. Don't believe that, this is something is wrong, it's something that I can handle. Always go for your checkup. Always go for checkup. Always go for your appointment. And if somebody that does not know and it not happens, the family member should not stigmatize them and leave them. They should bring them for assistance. And if you know that you are somebody that gets anxious, you understand, that you are anxious, then you should go for counseling. And there are some things you should do during pregnancy to prevent some things like this, like prenatal education. Go for your antenatal care, learn what they are going to do about it, the do's and don'ts, how you are going to manage yourself, so that you can mingle with other mothers over there.
They're like pregnant women of nowadays. I won't say they are so lazy, but they actually forget a point. We have prenatal, antenatal, but there is this point missing among pregnant women.
Okay.
That is the postnatal.
Yes.
Women just once you give birth,
they don't come. Some of them will even come back for their injections and all those treatments.
I want to go my house when they won't this and that. Back. The postnatal care is very, very important, and it's coming to play.
Yes, in a case like that, okay, if you come back for checkup, they will know. And if you even go, some of them does not even come for antenatal care. So where they do some investigations, and some of them will come when they are they want to give birth. During the delivery phase, that's where they start coming.
Someone told me she has never heard of antenatal before, and then she was heavily pregnant, and then during the ultrasound section, the ultrasound examination, and then we discovered that this powdering sign of the baby's head, indicating that this baby is dead. Madam, are you going for going for antenatal? She said, waiting be antenatal. Now it's like, waiting be antenatal. Like, are you going to clinic to see your nurse? No, I just relocated here, and then I don't know waiting be antenatal. I just see I get pain. The baby has been dead for 2 weeks from the ultrasound examination. So the head, we call it powdering sign. The head is kind of compressed, and the whole amniotic fluid is turbid.
Okay.
So that is an important point.
Okay, yes. Imagine that woman has actually gone for the antenatal care. That thing will have come up. If it's going for CS, if they are going to reduce it, whatever, it will have come up. And some of them does not plan for the future. They don't plan. They don't even know what they are supposed to do. They do not know, what is motherhood all about. So immediately they just give birth. They feel overwhelmed. The prayer of washing baby diaper, the prayer of cooking and changing, is something. Some of them are not even ready. They just find out that they are pregnant and they don't know what they are supposed to do. And they don't take, exercise. You do exercise to allay your fears, anxiety. If you are somebody that you just like exercise, like walking, swimming,
they need to know that reproduction, that is giving birth, it's way beyond getting pregnant, and giving birth. In fact, it includes breastfeeding.
Yes.
Of course, there are some lectures you need to go for breastfeeding. We have neonatal health, how you take care of your baby within the space of 2 years. There are some things I feel they need to know. Like, I'm really, really enjoying your company. Like, it's actually profound and insightful.
Thank you so much.
It's so nice to have you once again.
Yeah, thank you.
So now let's look at this question that has been burning in my heart.
Okay.
Is bipolar disorder, the process of pregnancy trigger bipolar disorder?
Yes, it's possible. A pregnancy can trigger bipolar disorder because of hormonal changes. Depression is under bipolar. It's just like a mood swing, a period of elevated emotions, like you see them being happy, exaggerating, restlessness, and there is other period of depression. That is, they enter depressive phase. It's just like somebody moving from the manic phase to a depressive phase. You understand? There was a period, like, it's just like people having mood swing. Normally, during pregnancy, every lady experience mood swings.
It's a normal thing.
Yes. You might be somebody that the woman dragged my hair. You might be playing now and you just touch her. She just changed. But maybe it's because you bought rice. Said, don't put meat. Now mistakenly put shaki or what. I'm not eating again. All those, So, but exaggeration of all those emotions is called bipolar. You understand? So it's possible. Somebody that have a mental health, that have a mental disorder, like a patient that have been treating bipolar before, it's possible there is a recurrence of that bipolar infection, bipolar disorder during pregnancy, and combined with what we have been talking about since the hormonal changes, neurotransmitter during that stage, there is increase in estrogen level, in progesterone levels, all those things, thyroid hormone, and all those things. People that have thyroid hormone, it can induce all these bipolar stuffs, like the disorder of thyroid gland, like hyperthyroidism and hypothyroidism, affecting the hypothalamus and the neurology, all sorts like that, can bring about bipolar, and people that does not rest, and people that does not have support. So that's why the family members should always try to assist them. You should always try. The husband should be there to support them. They should not leave them. Somebody that has a pre-existing bipolar should know that, okay, I'm a patient, I'm supposed to come for my checkup, I'm supposed to be, take my medication, so that this thing will not come up again. And if somebody that is being stressed, the husband should assist. During pregnancy, there should be a period of rest, there should be a period of attention. Sometimes some ladies do some things just to gain attention, but if you are not there, you're always busy, you don't have time for your wife and all those things, and she enters depression, emotional support. Yes, there's no emotional support. And the family member too should not just leave, especially people that are having their first baby,
first child.
They still need assistance. They do not have knowledge about that.
And also the society, the community.
Kotongora. That's why because you're not in my area, always go to check up on your people. Every woman is unique. Every pregnancy process is unique.
Every reproductive process is very unique.
And people with bipolar during pregnancy, they are unique beings. But if there is early detection and early treatment, everybody will have a peaceful and a perfect pregnancy period.
So in a simple way, communication and support is very important, both from the society, from the family, and from both partner. That is quite interesting. That is quite insightful. It's very profound, and to be sincere, I really enjoy this conversation. It's very enlightening, and I am very sure the Repro farm out there are also enjoying this. So now let's talk about this last question. We've talked about depression and anxiety. We talk more about them, the mental states. So how can women manage anxiety and depression during pregnancy?
Well, it is normal for every lady to feel anxious, especially people that are having their first child. So there are other ways to manage it so that it won't enter into a chronic or serious mental illness at the end. And talking about that, I mentioned something about prenatal care. So when you go for your prenatal appointment, that's when you get to understand some things that you're supposed to do. You meet some ladies, even people that have already passed through the phase of pregnancy once or twice. So they will enlighten you of some things. You meet your professionals talking about how you are going to do. So you have the knowledge about what you are supposed to do. You won't be blank, or you won't know. It's not like you won't know what you are supposed to do. Then you should plan for the future.
Planning is
plan
very
what
important.
is going to happen. Understand what is going to be, what is going to come up, and do not feed yourself too much with things that are online. Lagbaja is there. After pregnancy, he died, and all sorts of things like that. You can check, but you should not base your own knowledge. Everything should not be on what is going on online. You should always know that there are some things online is just for content, and so you should always know that you are not supposed to based on what is going to be online alone.
Don't get negative
negative views and negative talks about things, about what is going online. Then we talk about the exercise, that you should exercise regularly just to take away some burdens from your heart. Then surround yourself with people that are good,
not toxic people,
people that you can trusted family and friends. You should surround yourself. Eat healthy, like good diet.
Very important.
As a lady,
very, very
always
important.
eat. It's not like you go to work and you are now drinking garri and all those things. I know hormonal changes bring about change in your appetite, but at least try to eat healthy vegetables, fruits, and all sorts. Then you should not just stay in one place. Exercise. Light exercise. Some ladies, once they get pregnant like this, it's just for them to sit down and stretch their leg. And if you are becoming too anxious, you should go for a session. You can join a therapy group online. You can join a session group online. People that have passed through pregnancy phases and how it happens to them, how they can do it, how they can manage it, so that there will not be fear of unknown.
Of course, and they have to
you'll be enlightened about what motherhood is all about.
I feel they have to be very careful, because some might be impacting negative, experience that can even trigger more.
That's why I said you can learn online, but you should not make it the priority, like your source of
learn
knowledge.
From people that will give you
seek
better.
Go for your consultation, go for your appointment, ask necessary questions during your antenatal period. Don't just assume you are going to know it when you go to see your consultant. Okay, what am I supposed to do? How am I supposed to manage this situation once it come up? Don't believe that things like this is I'm going to manage it on my own. And your husband, your family should always look for you. They should always check up on you. Women can pass through a lot of changes,
emotional changes.
They can be irritable, they can be sad sometimes. Some of them will just start crying unknowingly without, there's nothing, they just want to cry and not be like, what is wrong with you? Is it only you? Why are you shedding tears? Stuff like that. So you should you should support your spouse and during pregnancy. So all those things will prevent all this mental illness. And if it's somebody that has mental disorder, and if it's someone that has mental disorder or has a pre-existing, or they have a predisposing family history of this particular mental illness, you should allow them to go for checkup. You understand?
Regular checkup.
Yes. I mean, somebody that have the disorder, you should go for your appointment. Don't overlook it. Don't allow oversight to affect it, so that you will avoid all those disorders that is going to, all this postpartum, all these postnatal disorders and conditions like that.
So Reprofarm, in a simple way, a very good way to maintain a good reproductive health and mental health, it requires two things. With everything you've said, all I can pinpoint is that it requires two key factors. Number one is regular checkup, and number two is habits. Habits, they say, it affects our quality of life, and it can also affect our physical health, mental health, and other aspects of our health. Regular exercise, good diet, and all those habits. Stop smoking. Adequate sleep, stress management,
but not excessive sleep.
Stress management. Don't smoke. Don't drink during pregnancy.
Mind yoga. You should go for mind yoga. So I'm pregnant. They say you should be sleeping.
Women are so fond of that. Actually, as in someone intentionally, a woman intentionally called me, like a young couple, and please, can you help me explain to my husband I'm pregnant? I don't want to sweep. I don't want to do this. I was like, madam, this is not right. You need to engage in exercise. So please engage in these good habits, and then regular checkup. Yes. So Reprofarm, reproductive health is way more than a woman getting pregnant and giving birth. I like saying that word. It requires some other aspects. There are some other components, some other aspects. We have the physical health. We have the sexual health. We have the maternal health, we have the neonatal, we have the reproductive tract microbiome or infection, we have the genetic aspect of it, we have the psychological aspect of it, which is one of the things we've treated today. Of course, we'll still be coming back to this show with you. I hope you will honor our invitation again. We want to look into some psychological aspects like sexual violence, sexual abuse. We want to look at we've talked about depression and anxiety today. We talked about fear.
Different
so we want to look at some other aspects of mental health and how they can influence our reproductive health. So Reprofarm, always remember your reproductive health matters. And Nurse Oshewa Ruth Oluwaseyi.
Yes,
I love to call your name in full because it's special to me. So Nurse Oshewa, it's really a privilege to have you on the show.
Thank you so
and
much.
I'm sure the Reprofarm out there, they also enjoy everything.
Thank you guys for having me.
You are welcome, and we'll be expecting you more on the show.
Thank you.
So Reprofarm, that is all you need to know on your reproductive health and how it can influence your mental health. So stay tuned, guys. If this is your first time on this show, this is Reprocare. You can show support by liking, sharing, and subscribing to our YouTube channel. And don't forget to follow us on our social media platform at KC Visual Studio. And also don't forget to follow me on my social media platform as Shilola Damlola Okoyemi. And what's your social media handle so people can follow you?
Shishisla.
Sheyi Sola, that's such a sweet name. So Reprofam, your support is very important to us. Your support will keep us going. And shout out to KC Visual Studio for this opportunity. Mr. Kensington, this is a big appreciation for this opportunity. And thank you, Reprofam.